Hello, everyone, and I'm so honored to be here with you. My name is Bellamy Young. I'm an actor and a very proud CARE ambassador. Thank you to all the speakers who have gone before us, the wisdom and the mindfulness, and I'm so excited to see what's to come. I've been boots on the ground with CARE in Rwanda and in DC last year for this summit. We learned how to make effective legislation, and then we lobbied on the Hill, which was one of the most incredible days of my life to date. Just to really remind us all, and I know that you beautiful, at least 800 people that are gathered here with us, you know that we are the people. Democracy is us, and we bring the change that is to come. So on that note, I would like to introduce you to the incredible humans that I have the honor of being in conversation with today. The first is Valerie Jarrett, whom you know served as a senior advisor to President Obama. During her time in the White House, she championed the creation of equality and opportunity for all Americans and helped cause economic and political empowerment for women in the US and all around the world. We are also honored to be speaking with Sofia Sprechmann Sineiro, the newly appointed Secretary General of CARE International. Though Sofia has been with CARE for over 25 years and has been integral in placing women and gender equity at the center of our work. Today, she is leading the organization toward another important moment in CARE's history, the development of CARE's 2030 vision. But before we get into questions with our esteemed conversationalists, I wanted to take a moment to add to the context that everyone else has provided, because we all know the moment that we are in. It is a very unique moment when fundamental aspects of structural inequity have been laid bare for us all to see. And these inequities impact everything from whether you can get an education, whether you can earn a living, whether you will have enough to eat, whether you are able to protect yourself from COVID or your family from COVID, or even whether you're able to move freely and safely in your own community. We are reminded yet again that justice is not equal. If we are to meet this moment, it is critical that women, particularly women from minority communities, are included and involved up front from moment one. Women's leadership is fundamental to building lasting solutions that promote equity and address underlying causes of the challenges we confront today and those we will confront tomorrow. So with that, I am thrilled to be joined by these two accomplished women for today's discussion. Valerie, I will. Hi. I am so glad to see your face.
That's how I feel about you and everybody who's joined us today. What a inspiring, replenishing conversation this is.
Amen to that. I will start with a question to you, my love. In the US, racial injustice remains pervasive across our country, from police brutality to economic and health disparities. Why do you think it's important to ensure that women, and particularly women of color, are at the table and have leadership roles as we address systemic issues?
Well, the people who have the most at stake, the most to lose, should be a part of the solution. And I think for far too long, women and women of color haven't had a seat at the table. As Shirley Chisholm used to say, if there isn't a seat, bring a folding chair. And we've been trying to muscle our way in. In the United States, women are half the population. And women also, 40% of women, working moms, are either the sole or primary breadwinner in a family. And so the decisions that are made around health to close the health disparities, around economics to close the wealth disparity, around important benefits from paid leave to paid sick days, to affordable childcare, to a workplace free from sexual harassment or violence. All of these issues affect women. And so why wouldn't you have the people with the most to lose at the table? And I would give you a visual that I will be seared in my mind for a very long time. When a couple of years ago, the Republicans in the Senate were trying to decide about whether or not to repeal the Affordable Care Act, a very important law here in the United States that has provided health care to 20 million Americans, many who've not had health care before, health insurance before, made sure that no one is discriminated against for a pre-existing condition, give women access to preventive care without a copay. When they were debating the issue, they formed a committee of 19 white men. They couldn't find any women in the Senate to participate when one of the issues is taking away preventive care that would have had a direct impact, particularly on women of color. Access to birth control, choosing when we have our family is one of the single most important issues that affects the trajectory of a woman's life. So there's a very good case to be made that given that women are half the population, we're graduating from college at higher rates than men, why wouldn't we have a seat at the table?
Amen to that. Thank you. Sofia, I would love it if you would speak to us all about why achieving social justice is a core part of CARE's mission.
Of course, at CARE for many years, we talked about addressing poverty and social injustice, but we really have evolved our thinking. We now say poverty is injustice because there's simply nothing fair about poverty. In this world, the group you're born into, your sex and race, ethnicity, sexuality, nationality, disability, defines how likely you are to go to school, experience violence, eat good food or eat at all, being healthy, survive a crisis, and whether you're likely to become a leader. So the simple, very, very random fact of where you are born has a huge and profound consequence for your life. So it is as simple and as complex, Bellamy, as this. We cannot end poverty without addressing social injustice. These fights belong together. They cannot be separated. So social injustice matters hugely to our work at CARE, since poverty is an injustice in itself. Poverty is injustice. And I might be stating the obvious, but poverty is injustice.
There's a lot of obvious things that we need to say out loud these days. So speak, 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 Sofia. Beautifully said. I'd like to ask both of you to give your thoughts to everyone on the following. We often talk about the importance of women being at the table to ensure that decisions and policies reflect women's needs. Do you see a correlation between more gender balanced leadership and more gender equitable responses? Sofia, let's start with you.
Well, I certainly do. There have been good examples of positive leadership from women during the COVID-19 crisis, such as from New Zealand or Germany and many other countries, in fact. We also have evidence of this from CARE's work, where we have promoted and encouraged women's leadership in response to emergencies. It has actually made all the difference to achieve better results. When women lead in emergency responses, we have seen increased cooperation within the community. We have seen communities recovering faster from the impact of a disaster. And we have also seen that women taking the opportunity of their engagement in responding to a disaster, taking that opportunity to rethink traditional gender norms and roles, both in their communities, but also in their homes. So with all of this positive evidence, it is just not acceptable that women are underrepresented in teams responding to COVID. Today, CARE released a report that is entitled, "Where Are the Women?" The report shows that women only make up about 1/4 of national teams responding to COVID. And by excluding women from decision-making teams and platforms, we are making slower progress in overcoming this crisis, in achieving social justice and equality, and in overcoming poverty. So absolutely, without women at the table, we will not make a dent on this crisis or on any crisis.
Valerie, please give us your thoughts too.
Well, no surprise, I completely agree with that. Look, I start from the proposition that diversity is a strength. It is a competitive advantage. And there is fortunately a mounting body of evidence that shows that the decision-making process is healthier, more robust, more informed if the people whose lives are going to be impacted by it are at the table. And that there is a different chemistry when women are present. They're going to look at life from a different perspective than men, just quite naturally because of who they are and what they are. And so to inform the decision-making process, we need to make sure that there are voices that look like all of us at the table. This isn't to the exclusion of men. Men are a part of the diversity too. But I do think that we process information differently, we lead differently, we're much more collaborative. And as we're facing this huge, huge pandemic, collaboration and cooperation and sharing of information is so absolutely essential. And here in the United States, as we're facing the challenges of the vestiges of slavery and Jim Crow and systemic racism that occurs across our country, the police department just simply being a microcosm of society, we need reasonable voices to come to the table who are empathetic and who emphasize cooperation and listening to one another and actually not talking at each other, but speaking with one another. And let's face it, we're just better at that.
Amen. I know we're running very short on time, but I want to be able to ask each of you this last question for your brief thoughts. Women are on the front line of the COVID response, whether they choose to be or not. They disproportionately are in caregiving roles, often unpaid, and in work that we are quickly recognizing as essential. They are also proactively stepping in. They find ways to get food. They help their community. They help their family. How do you see COVID impacting long-standing gender norms and underlying inequities? Valerie, let's start with you. And again, we have to be brief, although there's great knowledge to impart.
Look, COVID-19 has laid bare, as you said, Bellamy, in the introduction, some very basic disparities that have existed for a very long time. And as we emerge from this, I think it is important that we not slip backwards to where we were. And that will be hard to do because we've just been faced with the reality. I'll just zero in on one issue, paid sick days. We've been talking about that for just decades. The United States is one of the few countries that doesn't have a national paid sick policy or a national paid leave policy. Well, COVID has showed the impact that this has on the bottom line of companies where people are showing up to work sick and then spreading illnesses amongst them, as well as just the livelihood that has been put at risk because people can't afford to even take a day off from work. And so I think in a sense we have an opportunity here now that we've put a spotlight on what we on this call have known has been a challenge for a long time, to say as we rebuild moving forward, let's make sure that we put the safety nets in place so that women can succeed going forward when we are in these high risk, high impact, extremely valuable professions.
Sofia?
Well, of course, agreeing with Valerie, a lot of agreement here. But negatively, we know that the pandemic has, of course, led to increased rates of gender-based violence, which are already, if I may say, at pandemic levels, with 1 in 3 women experiencing violence in their lifetime. And as you mentioned, Bellamy, and due to gender norms, the burden of unpaid domestic work at home has increased for women around the globe in the context of the pandemic. Another example and consequence, women, especially in developing countries in the global south, are more likely to work in the informal sector, for example, as street vendors, where they have little or even no government protection. And of course, the majority of frontline workers in healthcare and other caring sectors are women. However, maybe let me end on a positive note. When all is disrupted in a crisis, space is also created for challenging existing gender norms. I have seen this frequently in my 25 years with CARE. Let me give you a very concrete example. Recently, I visited a country in crisis in Western Africa in which the use of contraceptives is taboo. Yet I saw women lining up in front of a clinic supported by CARE to obtain contraceptives. Given the crisis, their husbands, the community realized that it was better to plan for the birth of their next child. And we know from CARE's experience that once women start using contraception, there is no turning back. So in this case, the crisis led to significant change for women, a change which probably would not have so easily happened without such a crisis. A crisis is like a crack in the system, a crack into which to filter positive, transformative change in favor of equality, of social justice, and in favor of defeating poverty.
Sophia, thank you. What a beautiful note to end on. And Valerie, thank you too. I'm so honored to talk to you both today.